Thank you very much. I will be short. I'm a retired surgeon now. But when we're starting any discussion, the use of intraoperative cholangiography and the interpretation of the film from every surgeon to do a lab chole is very important, not only because of the stones, but the problems of the ductal injuries, which are catastrophic. You will hear it on Friday. Therefore, this is number one, what the new generation has to learn, or we have to tell them. May I have the first slide? Next one.
That should be going. What's he doing there?
This one? May I have the next slide? We had colleagues who thank you. In the past, in open surgery, we have around 500,000 cases with 10% incidence of stones. The retained stones were between 3 and 20%. But we improved it, we learned the intraoperative cholangiography and choledahoscopy, and the retained stones changed from 12 till 3%. And when lab chole started 22 years ago, it increased to 600, 650, or 750,000 per year, and we use intraoperative cholangiography, cystic, or CBD removal. Next slide. There were colleagues who learned it, and you can see from 85 to 100% they have success, and the patient had only one solution. Of course, next slide. If we're talking about the common bile duct stone, it's more difficult, but still we have a large percentage by those who were properly trained. Surgeons dropped the IOC, which is a great problem. There are many factors for it, the reimbursement, the extended overtime, etc. Therefore, we cannot teach old dogs to new tricks, but what we can do, that we're keeping an eye on the new generation, that they should learn intraoperative cholangiography. It's a moment. I think we don't do more than 3,000 laparoscopic bile duct exploration, but approximately 55 to 57,000 are referred to CBD stones, resulting in an ERCP. ERCP, even in the best hands, because there is not everywhere, Jeff Bonsky, is that the complications are existing, 4% pancreatitis clinically, 1% bleeding, 1% perforation. They can be treated per hospital, but it increased the healthcare incidence. Therefore, this situation has to be re-evaluated and individualized on the character, but I strongly recommend that the new generation should be trained how to do intraoperative cholangiography, how to explain or how to see the films and do the procedure if it's easy. Thank you.